I think there is a limit, to be absolutely honest with you, as to what they can learn from China's experience for a couple of reasons. The major reason is that, as some people have pointed out, and this is obviously an ironic statement, but it's worth saying, in some ways, we should probably be quite grateful, only in some ways, we should be quite grateful that the outbreak was in China, because it was a country that has a pretty advanced healthcare system for a middle-income country. And I think it's fair to say that Pakistan, to give an example of a country you just mentioned, is not a country that has that level of universalization of healthcare, and therefore some of the lessons that you could take from China, which involve shutting off cities and taking people as quickly as possible to newly built hospitals, are just less likely to apply to a country where the health infrastructure is much, much weaker. I think what it does suggest is that programs of mass vaccination, which over the longer term must be one of the few ways in which it can be possible to at least try and constrain the virus over the longer term, become very, very urgent. But I think, to be honest, the combination of authoritarian government and technological capacity that China has is relatively unique, globally speaking. Most other countries that have that level of technology, whatever, Western Europe, United States, Southern Europe, don't have governments that can clamp down that strongly because they're democracies and it just wouldn't work. And most other countries that are as authoritarian as China, Vietnam, or countries in various parts of the Middle East, perhaps, simply don't have that level of technical infrastructure in terms of the medical capacity. So to that extent, China actually is not an example you can just cut and paste and use elsewhere very easily.